Hi, my name is Ross. This is my presentation on Mycobacterium tuberculosis. Right here you see this is what the crude picture of what the virus or the bacteria looks like. So what is it? This certain strain of bacteria is considered a pathogen because it can cause illness. It's a short rod-like bacteria, so myco actually means waxy, so it's got a thick waxy coating. It's non-motile, it requires oxygen to grow, and it does not produce spores. It actually reproduces through binary fission, and it actually reproduces up to over 20 hours, so that's actually a lot longer than majority of bacteria. It can be detected primarily through an acid-fast stain. So this is due to the high content of the mycolic acid in that thick waxy coating I was talking about. You can test their blood or sputum cultures. In a gram stain, it could be inconclusive. It's considered gram positive, but at the same time, because of that thick waxy coating, the stain could not stick and it could be inconclusive results. So you still need to do an acid fast, and it's endospore negative because it does not do the sporulation process, so it does not produce spores. Here I have a picture of what it would look like in a gram stain, and then a picture of it in an acid fast stain. So we're the main reservoir that we know of. It generally will reside in lungs, and it gets in the respiratory tract through airborne droplets, but it does not mean that's the only place it can live. It can live in any part of your body. It can survive for weeks on other surfaces, such as like linens, carpets, soil, water, which is what kind of makes it more of a problem, is the fact that it can, reside in water and stuff. It has a longer lifespan whenever it's in our sputum rather than when it's on a different surface, and it's a mesophilic and aerobic, so that means it needs oxygen to be able to grow and live, and it also thrives best at moderate temperatures. It is the causative agent of the disease tuberculosis. This is characterized by a fever, muscle fatigue, cough with blood in your sputum. It's one of the few diseases that are considered to be airborne. So that means that you have to take whole different precautions than most other contagious diseases, because you can get it from just breathing in air close to people that have it. You can detect this with a couple different things. One of the ones, a diagnostic test that is used to confirm, is a chest x-ray, because they can see the disease process in the lungs that way. There's blood tests to check for the bacteria, of course. And then there's also a skin test that they do, like a subcutaneous injection in your arm. And you have to go back and get it read on another day. And I have a picture here of what it looks like whenever that is positive. So here's a chest x-ray of someone with tuberculosis. These are your lungs, and you can see the disease process. Like you see these. This shouldn't look like this. This should be a lot more clear looking. And then this is where they would have injected it in the arm, and then that's the reaction that you get whenever it's positive. So what's the relevance of this disease? It's not as prevalent in the United States and other first world countries as it used to be. It used to be pretty much a death sentence for people back in the day. And now it can still be threatening and prevalent in third world countries. And then there are some environmental conditions, like damp, crowded areas with poor circulation. They talk about prisons, crowded, dirty homes, that kind of stuff. And then you got treatment. So the main treatment for a bacterial infection is an antibiotic. Although it is stronger than most bacteria, so you need, like, common antibiotics aren't that effective. It's also resistant to quite a few different disinfectants, one of which that is not are these Cavi wipes. It's a main brand. If you ever work in the hospital, it's pretty much what you use for everything. It's Cavicide, but it is strong and actually kills the Mycobacterium tuberculosis. rifampin, ethambutol, isoniazid, and pyrazinamide are some of the main antibiotics used to treat TB. A lot of times they are used in conjunction with each other or with other supplemental medications. Because it's so strong, they don't want you to get like a or antibiotic resistant infection, and so you're taking multiple medications at once to kill an active infection. And then there's my works cited, Google Images for all my pictures, use the textbook for a lot of the information, and then I have 2 government websites and a Mayo Clinic that I use for a little bit of extra information. Thank you.